Erythema multiforme, M. The characteristic lesion is the target or bull's-eye macule with two or more concentric rings, the central one being often edematous with possible bulla formation, and the outer ring being erythematous. Other lesions including macules, papules and bullae may present on the trunk and extremities, including palms and soles. Mucosal lesions are often seen, particularly in severe cases of erythema multiforme, Stevens-Johnson's syndrome. According to the severity of the clinical involvement, M has been classified as major and minor. It is a reactive process that is usually triggered by viral or bacterial infections, exposure to drugs, or associated with neoplastic conditions. Among the infections, the two most common are herpes virus type 1 and Mycoplasma pneumonia. Among the offending drugs, the most common are sulfonamides and nonsteroidal anti-inflammatory drugs. Erythema multiforme pityriasis lichenoides et varioliformis. Acuta graft versus host disease lichen planus benign lichenoid keratosis lupus erythematosus sun. Damaged skin, radiation dermatitis, some drug reactions, photodrug, necrolytic migratory. Erythema acrodermatitis enteropathica toxic epidermal necrolysis, 10, ulcerative and febrile. Plava. The typical findings in erythema multiforme are characterized by a paravascular lymphocytic infiltrate in the upper dermis, with some sprinkling of lymphocytes toward the basal layer of the epidermis. There is often edema of the papillary dermis, which on occasion is so pronounced as to form a bulla. The epidermal basal layer shows hydropic degeneration and individual necrotic keratinocytes, dyskeratotic cells, Fig. 6.7. In older lesions, the necrotic keratinocytes may appear in the middle or upper part of the stratum malpighiae, the result of upward mobilization. Occasionally, M may show mainly dermal inflammatory changes and edema, with only minor epidermal involvement, dermal M. In severe cases, on the other hand, the necrosis of the epidermis can be prominent and become confluent, approaching toxic epidermal necrolysis. 10. It is unclear if 10 is the end spectrum of M or if it is a separate entity. We favor the latter, since the clinical presentation and the histologic findings point toward a specific condition. However, there is common ground between both entities, see below.